How do you deal with men and depression?
In the primary care setting, depression and anxiety is one of the most common diagnoses that we treat. Okay. And a lot of people, they don't realize that there is this stigma out there about mental health, right? That if you're depressed, you're crazy. The reality is we all go through depression. We all go through anxiety through our life. These are normal human emotions. A lot of men, if they admit to being depressed or anxious, they feel like it's a deficit or they feel weak, right? And so sometimes with male patients, sometimes you have to pull this out of them, right? And so sometimes it is hard to get that out of my male patients sometimes, but we deal with it the same way we deal with, any other patient, whether it's male, female, where we talk about, okay, what is actually causing the depression? So trying to identify that. And sometimes it's going to counseling, right? Sometimes it's medications. It all depends on the individual.
What do you do with someone who, you mentioned something, a key word there is the man has to identify it, confess and say, you know what, I do have depression. Mm-hmm. What if you have that patient who's stubborn and refuses to get any mental help? What would you do next in that case?
Well, I think it's education. I think that number one, as a healthcare provider, you have to build that relationship. If you have a patient that you're not able to make that connection with, or you haven't made that connection with, they don't feel comfortable talking to you. So I think the first thing is building that relationship and building that connection with that patient, because most of the time when that patient becomes comfortable with you, at that point, they feel comfortable opening up.
So this question may be more for a psychologist, but I want to see what your answer is based as, a nurse practitioner in your clinical setting. Who do you see more with depression? Do you see men or women, and why?
Well, so this is the thing, is we see more women with depression. And honestly, I think it's because women are more comfortable with sharing their emotions. I don't think it's because women get more depressed than men. And I think it's just that women are more comfortable reaching out for help, discussing their emotions. And again, it goes back to that stigma. If you're depressed, if you're anxious, you're crazy, right? Well, the thing is we have to get past that stigma. And the reality is, man or woman, that's what we're here for as healthcare providers, to address those concerns. And we just have to make sure that all of our patients, men and women, are both comfortable with having those discussions.
Hey guys, if you like this video and want to see more clips like this, click here. If you want to see the entire interview or the entire video, click here.